Hi everyone, my name is Anna, and today Ola, Mark, and I will be presenting about breast cancer. We will go over what breast cancer is, the types there are, who is most at risk for it, how to detect it, and how to treat it. So first, what is breast cancer? Breast cancer is a disease where cells in the breast grow uncontrollably. The abnormal cell growth is suspected to be caused by excessive exposure to the hormones estrogen and progesterone. It can start in different parts of the breast, either the ducts or the lobules, and it can sometimes spread to other parts of the body. It is one of the most common cancers worldwide, affecting primarily women but also men. So there are two categories of breast cancer: non invasive and invasive. Non invasive is characterized by the cancer being contained within the breast ducts or lobules. Invasive is characterized by the cancer spreading beyond the breast ducts or lobules. Two common types of non invasive cancer are ductal carcinoma in situ, or DCIS, and lobular carcinoma in situ, or LCIS. DCIS is when the abnormal cell growth is in the milk ducts and is not spread beyond them. This is an early stage and it is highly treatable. Whereas LCIS is in the lobules and isn't considered as cancer itself, but it does increase the risk of developing invasive cancer later on. For invasive breast cancer, we're going to be going over just a couple different types. The first one is invasive lobular carcinoma, or ILC. It starts in the lobules and spreads to the nearby breast tissue. ILC can spread even further by entering the lymph nodes. And then the next one is inflammatory breast cancer, or IBC. It is considered very aggressive. The cancer cells enter and clog the lymphatic vessels, causing redness and swelling of the breast. It is not unusual for IBC to be mistaken for a breast infection. Next one is Paget's disease of the breast, completely unrelated to Paget's disease of the bone. It is a rare form of cancer affecting the nipple and the areola. It is often linked to underlying ductal breast cancer. Last one is male breast cancer. It is rare, but it does occur, affecting mostly older men. However, this does not mean it's not possible for a younger man to get it. And almost always, when a man has breast cancer, it is invasive. Now over to Ola.
Hello everyone, my name is Olha, and I will continue on topic of breast cancer. There are some risk factors for this type of cancer, and being a woman is the main risk. While men also get this disease, it is about 100 times more common in women than in men. The risk for breast cancer increases with age. Most breast cancers are diagnosed after age of 50 or 55. A positive family history increases the chance of breast cancer as well. Personal health history. Women who have had breast cancer are more likely to get breast cancer a second time. A woman with cancer in one breast has the greater chance of getting a new cancer in the other breast or in another part of the same breast. Having dense breast tissue can make it harder to detect tumors on a mammogram and increase the risk of breast cancer. Reproductive history. So this is related to the history of menstruation and pregnancy. Those women who have menstruation at early age before 12, get late menopause after 55 years of age, have their first baby after 35, do improper breastfeeding, or never gave birth to a child are at higher risk of breast cancer. Signs and symptoms generally involve a change in the woman's breast, most often a new lump or a mass. Breast swelling, even with no lump present, changes in the breast skin, such as irritation, redness, scale, dimpling, and thickening. Fluid leaking from the nipple that isn't breast milk, inverted nipple, pain in the nipple or in the breast. If a woman detects one of the above symptoms, she should see an oncologist. Key point about breast cancer diagnosis and screening. A doctor performs a breast exam and reviews any imaging tests. Mammography is the most common screening test for breast cancer, typically recommended for women starting at age 40. If a screening test shows abnormalities, the doctor will order additional tests like breast ultrasound or MRI that may be used to get a more detailed picture of the area of concern. A biopsy is the only definitive way to diagnose breast cancer, where a small sample of tissue is removed from the breast and examined under a microscope. The doctor will review the test results and confirm or rule out a diagnosis. Then the doctor will determine the stage of the breast cancer and recommend a treatment plan.
My name is Mark Juarez. I'm going to be covering the breast cancer current research, lifestyle changes, and treatment options. One of the most important things that I want to note is, do you actually want to get tested for breast cancer once you figure out that maybe your mom, your dad had breast cancer, or maybe your sister? It's important to note that some people have a lot of anxiety, depression after finding out that they do have breast cancer. It's super important to make the decision beforehand, going through all these tests and studies and talking to your geneticist. So the BRCA1 and the BRCA2 are the genes associated with the breast cancer. You would most likely get a mammogram, an ultrasound, an MRI, or a biopsy. Once a geneticist confirms that you have the breast cancer, the geneticist would go to you and then come up with some treatment options. So you can get a lumpectomy or you can get a mastectomy. The lumpectomy being the removal of the tumor, sparing the breast. Also comes with a reconstructive surgery after. The reconstructive surgery is very common, and it's just like, so there's a mastectomy too. The mastectomy is the entire removal of the breast, both right, left, or both at one time. So you would get a mastectomy if you have multiple tumors in the breast, or if the tumor is just too large and the possibility of sparing the breast is out the window. Also, another thing is the radiation therapy. If radiation therapy is not convenient, then they would most likely aim for a mastectomy. The last thing is the diet and the exercise. A lot of people, I think, in my opinion, overlook the diet and the exercise. There's a lot of studies that show that people that work out, that have a good diet and have good habits, sleep their 8 hours, and overall are healthy and motivated to make the best machine they can make, these kind of patients are going to recover from surgery way faster than a patient that doesn't run, doesn't do any aerobic exercises, doesn't do any weight bearing exercises. Having a high protein and low fat diet is most important. It's recommended that you do about an hour of exercise. So a person that exercises is most likely going to be more focused, more grounded with themselves. They're going to be less stressed out and overall happier. Thank you.